When patients come into the office because they have complaints of jaw pain or clicking and popping in their jaw, or their teeth hurt, they have sensitive to hot and cold, we do a comprehensive exam and figure out what exactly is causing their problem. We use something called DTR, which stands for disclusion time reduction. The way the bite works is the front teeth rub together and allow the back teeth to separate and give the mouth a break. If your mouth isn't set up that way, it needs to be. And there are patients who we have to do orthodontic treatment on in order to get them that way, but most patients can go through a simple bite adjustment or an addition of some bite material or some composite material to their teeth, and we're able to get their bite comfortable in under an hour. They have the appointment 3 times, and usually by the second visit they're feeling tremendous amount of pain reduction. And we have many patients who've gone through this, and we tell them come back in 6 months or a year if you continue to have a problem, and they don't have to come back because they're feeling good. And we're happy to offer that technology. And we even use the sensor now to check bites just when we complete a case, which you can't get in too many places. The technology that we use here is called T-scan, which is a way to measure patients' bites. And the philosophy behind it is when you go to a dentist, they typically will use carbon paper to check your bite. That carbon paper does not tell the dentist how much force per tooth is actually happening. So what could look like this is the tooth that's in the way isn't necessarily the tooth that's in the way. When you use the T-scan technology, the patient bites down on the sensor and we can see exactly which area needs to be adjusted in order to give them an equal intensity bite, as we say. So many of our patients come in and tell us, oh, I had Botox treatment. I go for regular Botox treatment in my jaw muscles to stop my problem, and it seems to work pretty well. There's some advantages and disadvantages. The biggest disadvantage is it's a Band-Aid. Your bite problem is still there. So even though your muscles may not be hurting, you could be breaking your teeth, cracking your teeth, causing sensitivity. 95% of jaw problems are muscular, and the only way to solve that problem is to get the bite right. I had a patient who's a teacher on Long Island come in who saw some of our marketing on a video, and she said that she has a condition called trigeminal neuralgia, which, if you haven't heard of it, it's something where the main nerve that supplies the jaw is injured and has an irritation and can cause tremendous amounts of pain. She had been to experts at Cornell and they diagnosed it and they put her on some very strong anti-seizure medication. She was a candidate and we did the DTR on her, and she came back for her 1 week and her 1 month process. She actually came back after 6 months for another touch-up. It's now been a year and a half, and she is doing great.